was really cool, by the way.
I love lamp.
I feel no shame, only pride, because my syphilis is a badge of honor.
How, in the name of Zeus's butthole, did you get out of your cell?
Just the facts, ma'am.
He thinks I made it up.
Unbelievable.
I never thought anybody could forget so much so fast without a severe blow to the head.
And you know, when you say per capita, this many per capita is just like per capita relative to what? You have nobody guarding your potatoes. We're honored to have with us today our amazing Vice President, Mike Pence, and his wonderful wife, Karen. Once it was reluctantly aroused. It was hard to get it aroused, and it is hard to get it aroused, but we got it aroused.
Moon River.
The sportos, the motorheads, geeks, sluts, bloods, wastoids, dweebies, dickheads. They all adore him. They think he's a righteous dude.
What do you say we cut the chit-chat? A-hole!
All right. Stop right there, and I'll bring back the sun.
Just looking around here, I can tell you're a genuinely dirty person.
I have come here to chew bubblegum and kick ass. And I'm all out of bubblegum.
We need you. Hell, I need you. I'm a mess without you. I miss you so damn much. I miss being with you. I miss being near you. I miss your laugh. I miss your scent. I miss your musk. When this all gets sorted out, I think you and me should get an apartment together.
Am I getting through to you? Over!
I gotta barbecue your assy molasses!
You stay classy, San Diego.
I guess what I learned most of all was that you should always take responsibility for your actions, unless you don't have to.
Check one, check two. Good to me. Just go live. Well, I'm a little blurry. There you go. That's a little better. Okay. Hi, everybody. Happy Tuesday. Hope you enjoyed your long weekend. I realized later in the day after I was under a pile of honeydew projects that I didn't really list that I wouldn't be streaming yesterday, but honest to God, I was torn about it. I really was, because I missed you guys. But on the other hand, I felt like if I started down the rabbit hole of picking apart what Trump said on Memorial Day, even beyond the hell thing and whatever, I would get myself in hot water. So I figured it was best to sidestep that the chance for me to step in it, as it were, and save my powder dry for today. You know what I'm saying? So the president is apparently talking to him. Thank you, Andy Sochel. But I would not want for a second for people to think otherwise. So I will not let Trump dictate whether or not I say something that people could misconstrue as being negative towards them. You know what I'm saying? So that's crucial that's important to me, regardless of what, I know you guys get it and I know you guys understand it, but I'm not going to be repurposed. I'm not going to become fuel for the other side. It's been very important to me. And I don't know if I'm trying to avoid that as much as possible while remaining my feisty self. So we're going to talk about Trump's discussion about apparently, I mean, the title of this one alone, and I have not seen it. I've been driving. I avoided it. I wanted it to be fresh. Dew picked and flown in from Iraq. Oh yes, my hair is very fluffy today. It's just very. I didn't do anything. I just couldn't do anything with it. This is the name of this one is President Trump delivers remarks on protecting seniors with diabetes, or as I like to call it, the pot calling the kettle black speech. So there, yes, Crunchy Frog, well spotted. Thanks, Noel. It is very. It's a jazzy do. It's very, very Beatlesy. Yeah. Don't know. Yeah. So nice hair toss, Auntie Seychelle. All right, here we go. So let's dive into this, and we will, we'll have a little bit of a hang ourselves too. My audio is a bit muffled. Is that true? Is it muffled? Is there a muffledy? Is audio okay? Is that the case? It's all right. I think it should be okay. I will bring up the volume a little bit. I just want to make sure before we dive in that that's, a part of this situation. Yeah, sounds a bit compressed. That is true. I do have a compressor on it. So I'll bring that down. Bring the kind of thing. How about I just, because it's not necessary right now, I'll bring that down and then I'll pick the noise gain. And is that better? Is that a little bit? A little compressed, but I took the compressor off just to. I keep trying to make my tones dulcety, as it were, you guys. So I hope it works out. I hope, by God, keep them as dulcety as I can. So all right, here we go. Popping up on volume. Yes, it should be louder a little bit. But hopefully it won't get too hot if I don't get too carried away. We should be all right. Yeah. All right, here we go. Very excited, more than you can even possibly know. All right, here we go. Let's see what he says today. President Trump delivered remarks on protecting seniors with diabetes. Yeah.
Distancing. I've never seen distancing like that. That's really.
Oh God, it's the you're social distancing. You're very practicing it very well.
That's really very impressive.
Why would it be impressive at the amount of social distancing? That just means there's fewer people present, or it's on the lawn. It really shows a tremendous amount of strength.
And welcome to the Rose Garden as we take powerful action to lower health care costs for America's seniors. Today, I'm proud to announce that we have reached a breakthrough agreement to dramatically slash the out-of-pocket cost of insulin. You know what's happened to insulin over the years, right? Through the roof. Insulin. So many.
Right. Yeah, this has been an issue that Democrats have been pushing for a long time. You notice how most of the stuff he tends to get done is stuff that in a panic he forces Republicans to do. And yes, he is quite orangey today, with a wisp of yellow in his hair. If you'll notice, the tassels look a bit orangey, and there's a bit of blue in the red. So this is that's the natural. They're toning it down so he's even oranger. He's more orangey than usual.
People, so necessary.
Really? What does it do? Tell us what insulin is for. Who uses insulin? Before you finish reading the book, did somebody just shut the door behind them?
Hundreds and thousands of seniors enrolled in Medicare. That's a big deal. Participating plans will cap cost at just $35 a month per type of insulin, and some plans may offer it free. So for everybody that was getting ripped off and paying
by Medicare,
tremendous prices, senior citizens. And Seema, I want to thank you because you brought this to my attention a long time ago, and you worked very hard.
So if you're not, if you're under 65, does that mean your insulin costs are going to go up? Are you balancing it out? Did you just buy a bunch of it? Is this an executive order?
This day, and the press won't even cover it. But
he just found out he needs it. He's like, this is too expensive. You got to remember, I'm a pretend billionaire.
They'll cover things that are unimportant. But
what's unimportant? All the stupid things that Medicare covers, it's not important.
It's a big day for seniors. This is a tremendous saving. And
for diabetic seniors, sure.
And it allows people that, if you don't take insulin, I just wrote this down.
Oh boy. What happens if you don't take insulin? I can't wait. I'm excited. Oh, thank you for subscribing, Jess Dollface.
Go blind.
If you don't take insulin, you could go blind. He just heard this. Wait, he wrote this down?
Stroke, amputation, kidney failure, and other things.
And other things that if you don't take insulin, you know your body produces insulin, right? You're not going to start injecting insulin into non-diabetic seniors, do you? That comes from, oh God.
So we're getting it out.
This is, those are caused by diabetes, not taking insulin. My audio's fine, but Trump still sounds a little stupid. I do not have a plug-in that will fix that. If I did, I would have used it 3 years ago.
$35 per month, and it would be
$35 a month. Extra in Medicare, or
anywhere from $50 to $150 to over $200 a month. So it's a massive cut, I guess 60-70%.
You guess? How much is it? Yeah. How much do they normally pay Medicare? What's the change in price? Did you do it by making a massive purchase? Is it a one-time thing? Is it ongoing?
Nobody's seen anything like this for a long time. Sleepy Joe can't do this, that I can tell you. In fact,
yeah, he's not the president right now. He was just vice president before. But Sleepy Joe can't do this.
It was his problem with Obamacare that caused part of your problem.
Really? Obamacare caused the price of insulin to go up? For Medicare patients? How much are people who aren't on Medicare going to be paying for insulin to make up for the change in price for Medicare patients? Unless you capped it. Did you cap it?
This will save impacted Americans an average of minimum $446 just on insulin costs a year.
A year. For Medicare patients.
We're pleased to be joined by Vice President Mike Pence and Surgeon General Jerome Adams. I also want to thank Seema again. Thank you very much for the...
Thanks again for... Oh, God. What is this about? By the way, don't forget to take your insulin so you don't get your foot cut off right after you... you know what? Just put hydroxychloroquine and bleach in the same syringe. Save yourself some time.
Done helping achieve the incredible victory for Medicare patients nationwide. In the past, Obamacare prevented insurance providers from competing to offer lower costs for seniors. There was no...
Did they? Did Obamacare stop it?
Competition. There was no anything, and they ran away with what took place. And
they ran away with what took place.
Seniors were horribly hurt.
Seniors were horribly hurt by Obamacare. It was terrible.
Many people couldn't take insulin. They couldn't even think about it.
They couldn't even think about taking insulin. A lot of people couldn't even, if you didn't have diabetes, you couldn't even get any from your doctor. Now, he's giving, what? Diabetics, you're going to be sharing your insulin with all other seniors. For $35 a month, we're now injecting everyone. Thank you, 1524 Scooter.
As a result, Medicare beneficiaries with
beneficiaries? Is that a good hole in you?
Prescription drug coverage paid an average of $675 for a year's supply of insulin, and sometimes as high as $1,500. Harmful laws also
for a year's supply. Oh, thanks.
Meant that seniors often paid a different amount almost every single month. They had no idea what they were paying. They were billed. Every month they were pilled a different
They were pilled a different pill? They were billed a different pill?
amount, and it was a massive amount. 1 in every 3 seniors on Medicare has diabetes, and over 3.3 million beneficiaries use at least one type of insulin. Over the
Uh-huh. So 2/3 of Medicare recipients don't benefit from this at all. But okay, all right. I'm cool if you want to cut the price of insulin. How you doing it? Huh? Is it temporary?
past 10 years, these seniors have seen their out-of-pocket costs for this life-saving treatment almost double. I don't
Wonder why.
use insulin, should I be?
Oh my God. I don't use insulin. Should I be? Psst. He uses insulin. What? What is, how dumb? I mean, like there's, there's a lot of per capitas. Depends on what you mean by per capita. That's always a fun one with him. His thing is the more you test, the more cases you have. But now he's asking like it's a, yeah. He's asking like it's a medicine. Do you know what? Does he know what insulin is?
Huh? I never thought about it.
Oh my God. I never thought about it. Now you're thinking about it because it's so cheap? Is that why? It's only $35 a month. So why not? As a fake billionaire, even I can afford that. What are you talking about?
But I know a lot of people are very badly affected, right?
Very badly affected by what? By not having insulin or using insulin when they're not supposed to?
Unbelievable. That's why my administration acted decisively. We slashed Obamacare's crippling requirements and opened up competition like they've never seen before. They've never seen competition like this.
No, they've never seen competition like this before. So are you now allowing Medicare to compete for to negotiate drug prices?
But
are you doing that now? Is that Democratic plan now in place?
being transparent,
or is it just on insulin, which you should probably be taking if your waistline and your neck are any indication?
see, and all of the other things we're doing, nobody's ever had a competitive situation created like we've done it, and the prices you will see very soon, they're going to come tumbling down.
Are they? Thank you, Georgina. At work, we would say it's Fruit Loops with no milk. Yeah.
Then
okay, stick to your prepared marks and point your finger at the page, because so far, you're not doing yourself any favors.
he brought all the parties to the table, insurers, manufacturers, and other key players, and reached an agreement to deliver insulin at stable and drastically lower out-of-pocket costs for our seniors.
Why for seniors then? Why not for everybody else? Why wouldn't you want it for Medicaid? Why can't Americans do that? Why can't like unions and people, like large groups that buy into large health plans, why can't they negotiate for the same price then? If Medicare patients are getting $35 a month, I mean, why?
I hope the seniors are going to remember it, because
I'm going to need to buy their votes.
Biden is the one that put us into the jam because they didn't know what they were doing. They were incompetent.
Oh, were they?
Soon, nearly half of all eligible Part D and Medicare Advantage
Nearly half?
prescription drug plans will offer this low-cost option. And when you say low,
why would you offer a low-cost option? Are you capping the price or not?
cost, you're really talking low-cost, giving seniors the freedom and choice to pick the plan that's right for them.
Uh-huh. So, is there a plan where insulin is more expensive?
Nothing will ever stop me
Who made that deal?
from fulfilling my solemn duty to America's seniors.
Oh, yeah. Well, your solemn duty to America's seniors. Have you checked the COVID death rates?
I'll use every power at my disposal to lower drug prices, and my administration.
Whoa. You use every power at your disposal to lower drug prices. Okay, head over to the Senate. Tell Mitch McConnell to pass the bill that allows us to negotiate drug prices and compete with Canada, the UK, and.
Will always protect Medicare and Social Security.
Thank you, Joe Carter.
And by the way, pre-existing conditions.
How? How you gonna protect pre-existing conditions? How? What's your mechanism? Who pays for it? Do all the private insurance companies? They're just gonna eat the cost? Is there a government subsidy? Is everybody else unfairly subsidizing the people who require it? Is that going to be factored into their insurance payments, or is the government going to subsidize that part of it?
And we got rid of the individual mandate, which is
which would have paid for it.
a disaster. The worst part of Obamacare was
it really that everybody needs insurance so that people without insurance don't go into the hospital all the time, and that's why we all pay $500 for an aspirin to pay for all the people who have run off without paying for their aspirin?
Individual mandate. When we got rid of the individual mandate, essentially we got rid of Obamacare, if you want to know the truth. You can say that in the truest form.
Well, no, you didn't actually. You just eliminated one of the ways to pay for it, and you have no other way to pay for it. You want all the stuff that's in it, but you don't want to do the work.
But we got rid of a horrible, horrible condition called the individual mandate.
That's a condition? Oh, really? What do you take for that? Hydroxychloroquine and bleach? Yeah, if you have, ask your doctor about the brown nose.
But we'll always protect you on pre-existing conditions.
How? How do you pay for pre-existing conditions if you don't spread the cost over a greater number of people? How do you do it? By the way, you don't. You don't. That's why they'll eliminate the individual mandate. But now the government is picking up the cost on its own for all the Obamacare situation, because it's just goofy. Like, this is just nonsense.
Much more so than the Democrats.
Really? Do they just hate? That's why they passed the Affordable Care Act. Where's that Republican plan? It was supposed to be here, I forget, in a very short period of time, right after his taxes and the second half of his health exam at Walter Reed.
Here with us today is Bruce Broussard, President and CEO of a big, powerful healthcare company, Humana. And I'd like to have Bruce come up and say a few words, please. Bruce, thank you. That's a big company. Look how young he is, too. That's very young to be running such a big company.
Well, thank you very much, Mr. President.
Thank you, Bruce.
Well, I speak on behalf of our 50,000 teammates that work at Humana, that we are thankful of being
for the government to subsidize this part.
And honored. The demo that you were describing just recently is an example of the strength of public-private partnerships and dealing with large issues such as the affordability of prescription drugs. And insulin is by far the one that is used the most. Another great example of that is the response to COVID and the crisis. And
how? You're with Humana. Explain to us what the situation is where, by the way, are you instigating, is Humana carrying out Medicaid's supply of insulin? Does anybody know what the hell they're talking about?
Think about one of our customers, Gwen, that just
Gwen.
Recently we served, that was blind.
And now she can see. Drop kick me, Jesus, through the goalposts of life.
Not have access to food. No one could support her because no one was in the vicinity to help her. And in addition, didn't have access to her prescriptions. And through a strong private-public partnership, we were able to offer her food and prescriptions delivered to her home.
You mean charity groups and the government provided everything else, and you guys cut her some sort of a rate on her prescriptions?
So I want to thank the administration.
You delivered them? How? What are you talking about? Is Humana delivering meals now? No.
For continuing to pick on large issues like this and bringing in the private enterprise to assist in that. So thank you, Seema, and everything you've done. So thank you.
What a job you've done, too. Really an amazing job. And
thank you.
You're also in the right business, right?
Well, if we can help any senior, we're always in the right
That's
business.
good. That's good. Oh, you've really helped. We appreciate it very much. Thank you, Bruce.
What does it mean you're in the right business? To what, make money because there's a pandemic and he's in healthcare?
We're also joined by Tracy Brown, the CEO of American Diabetes Association, and a lot of bad things can happen without insulin in terms of diabetes and other things. Please, Tracy.
Tracy, come on up and tell us what can happen to you if you don't get insulin.
Thank you very much. Hi, Tracy.
Thank you, Mr. President. Thank you, Administrator Verma.
I'm wearing a mask because you're all disgusting.
For making this afternoon one that we can focus on the 34 million Americans, like myself, who's living with diabetes, 7 million of which need insulin to live. 25% of these individuals have told us that they ration or skip doses of their medicine because they simply cannot afford it.
I appreciate that she's bringing attention to this, and she works with the organization that advocates for people with diabetes. But he's talking about a third of Medicaid participants, a very narrow group of Americans, and everybody else is still paying full price or more. Is this going to offset the cost for other people? Is there a way? Is it going to make it more expensive because you're subsidizing and lowering the cost elsewhere? Where's the $35 price tag come from?
And so this effort, CMI, MMI demonstration project that brings together the government, industry, and public health advocacy from the American Diabetes Association is the right thing to do, and we're thrilled to take this challenge head on. Today, together, we are helping millions of seniors access insulin affordably. This is a very big deal.
Or as Joe Biden would say, the big, all right, never mind.
American Diabetes Association is the nation's leading organization that fights for people living with diabetes, and we are committed to continue to partner to make sure every American, and especially our seniors, have access to the medicine that they need to live. So thank you, Mr. President, and thank you, Administrator Verma.
So, Tracy, are you surprised at how much we've gotten the price down to what?
Oh, my God. You didn't glad hand me enough. You're not here to advocate for people with diabetes or push a program forward or make it expand and think this is planting some kind of a seed. I'm buying old people votes to make up for the ones that I shrug off who are dying.
And to the level that we brought it down to?
This is a very exciting day for people living with diabetes, and so any step to bring this lower is a good news. We know that we need to do more, but I'm so confident that together we are going to be able to help all people living with diabetes thrive.
Good. Thank you very much. Appreciate it, Tracy.
Well done. She was definitely, I'm just saying she's riding with Biden. You could tell by how she's talking here. Very smart choice of language on her part.
I'd like to also.
Why didn't you give a number? Why didn't you say from $600 down to $200 for them? Why are you now complaining that there's other people with diabetes?
Invite up.
What's diabetes? I thought insulin was like Prozac.
David Ricks, Chairman and CEO of Eli Lilly and Company. A very big and a very great company. Please, there's another young guy.
You think he's getting sensitive about his age right now?
Thank you, Mr. President.
Thank you very much, David.
Pleasure to be here. Really an honor to be a part of this announcement to improve the lives of so many patients who live with diabetes in our Part D program. For several years, Lilly's worked hard to improve insulin affordability, and this has been a missing piece that's now been filled in by the great collaboration from our plan companies like Bruce's who are here, Seema Verma, your administration, Vice President Pence, President Trump. Thank you for your leadership to make this happen.
So how are you shaving off the cost of this? Is it simply a budgetary addition? Are you using discretionary funds to do it? Because I'm cool with doing it, but like this wasn't done through legislation. So, and does this now set a standard that you got to match on everything else?
This is the kind of class.
No, because I'm kidding. Because I'm out of sync. My face is out of sync. Hold on, let me check this. Make sure. What's up? No, it doesn't look out of sync where I am. Might want to restart your browser. In theory,
That solves real problems for people with serious issues like diabetes. Today, if you take Lilly insulin, you will not.
Lily Insulin. She's a lovely girl. Ladies and gentlemen, Lily Insulin. She's going to sing, I'm just a little teacup. Let's sing, sing, sing. Why aren't you wearing your lipstick, Lily Insulin?
Pay more than $35 except for in the Part D program. And we're pleased to add this missing part to that equation so that starting next year, seniors will benefit from that same savings level, just a little bit more than $1 a day for insulin.
Wait, so they were already getting it in Medicare Part D, and they're just expanding this part of it?
That same spirit of collaboration is also being applied to collaboration around COVID-19. And I think everyone's aware that there's thousands of scientists working in our industry, along with NIH and other experts, to speed around the clock.
Thank you, Patricia.
New therapies for patients suffering from COVID-19 and to arrest and extinguish this pandemic. I've never been more proud to be a part of that effort as well in the same spirit of collaboration.
You're more proud right now about your company working on COVID-19 than when they worked on COVID-19 last year? I've never been more proud to do what I'm doing right now that no one ever had to do before. Thank you.
Is being applied in that incredibly important crisis as well. Together, by working together, I think we...
Okay, by the way, have we noticed that we've gotten to the part where he spilled the beans and this was already an existing part of Medicare Part D and they're just expanding it to another group of people? And I'm for the expansion, but can they stop? Are they going to give credit to the previous administrations who came up with the Medicare Part D expansion in the first place? No.
Today, we can solve long-term problems.
I agree I need to use my Discord more often, but I have, in my defense, I've been in the car.
And I hope I can come back someday and show that we've solved the immediate problem of COVID-19 working as an industry along with government. So thanks for having me here.
Find immediate problem.
Good, and I think we will. Thank you very much. Thanks, Dave.
And you think you will? All right.
Appreciate it. Really good job. I also want to thank the companies with us today for rising to the occasion in our fight against the invisible enemy. Humana and other insurers have agreed to waive copays, which is a very great thing to do. It's a big deal. Thank you very much.
Because it's a contagion, and it will. If they don't waive the copay, people wait longer, and then the intervention costs are much higher, and then they end up paying it.
Coinsurance, deductibles, coronavirus treatments for most enrollees. I mean, what they did is really...
Most? Which ones are getting... Which what?
People that aren't in the business.
Why most?
Or even in business, period. They wouldn't realize how big a thing that is, but it's a very big thing.
Oh, you mean people who, like kids? What do you mean? People who don't do business don't realize how this will mess with profits. No one would have... Sleepy Joe has never been in business.
Appreciate it very much. Coronavirus treatment for most enrollees has been...
Most? Interesting. What excludes some people? Why most?
We've been moving along and we're doing well. We're going to be reporting on it in just a second.
Oh, yeah? Oh, good. Oh, there's going to be a report.
Sanofi is working at breakneck speed to create a vaccine. Eli Lilly has been developing therapeutics for coronavirus and expanding a free drive-through testing operations. And thank you all for the work. It's been great. We're battling.
Yeah, have you guys gone through you guys done a drive-through? Anybody in the chat done a drive-through test? I've seen them on the news. I went and got the serology test. I'm still waiting for my my results. But
the virus on every front, speeding relief to our workers and pursuing therapies and vaccines at record speed. We have many companies right now. I think we can say very far down the line on vaccines and therapeutics.
Down the line. They're down the line on it, man. They're in phase 1 clinical trials. Oxford has a phase 2 clinical trial that's going to start with 30,000 participants, mostly old folks and children. Now convince all your redneck followers that they need to get a vaccine. Good luck.
And cures, frankly. I think cures are going to be in there very
Define cure.
shortly.
What do you mean cure? It's a virus.
Manufacturing vast quantities and medical equipment, supplies, all of the different things that you need. We've energized our military. Our military is ready logistically to go out and just
inject everyone with a vaccine that's fresh off the, hasn't been fully tested. We're going to get it as quick and into your veins as possible. Can you imagine what the QAnon people would be saying if Obama came out and said, we're going to have a vaccine? Just a couple months. Record setting. Faster than anything. And we're going to have the military injected into everyone. Like, they would. Are you kidding me? Are you kidding me? So explain yourselves, QAnon and right-wingers. This guy is going to speed a vaccine through and then have the military inject it into everyone. You good with that? All right.
Contribute whatever it is we come up with, and I think we're going to come up with a lot. I think we're going to have...
Whatever we're going to come up with, we're going to come up with a lot. Nonsense.
Therapeutic remedies, and I think we're going to have vaccines very shortly. I've been saying
based on what?
It very shortly. I think I'll be proven correct. If I'm not, I'm sure the media will let us know about it.
You won't? So it's up to the media to define.
We're safely reopening our country.
Oh, are we?
Well, aggressively.
Have you seen the videos? Does it look like people are safely reopening?
Protecting the vulnerable, especially our seniors. We're telling our seniors to stay back a little bit. Stay back.
Stay back a little bit. Easy. Easy. Hey, stay behind the velvet rope, old people. Teachers don't go to schools. Kids go to school. Go to school immediately. But teachers don't go to school until it's safe. Just let the kids run around the building.
This thing pass. We're not only keeping older Americans safe from the virus, we're also ensuring that they have the best medical care on earth at a price that they can afford. That's what happened with insulin. Nobody can believe it when they hear the price for the insulin.
Why not? It already exists for Medicare Part D. You expanded it. I can believe the price. That price was available to anybody who participated in Medicare Part D. And by the way, you just said that it's only available in some of the plans, which sounds like they can just pick to use Medicare Part D. What?
It's been an amazing difference, and Seema's going to be talking about
what's different about it.
That's not just like a 10% drop or a 5% drop, which by itself would be good. That's a big drop. That's a really big drop.
Yeah, give me the percentage. What's the difference between where Medicare Part D was and what you're suggesting? Oh, it's the exact same amount.
We approved a record number of generics and reversed the trend of soaring drug prices.
Generic insulin?
For the first time in over 50 years. First time we've ever had prices go down. Average basic Part D premiums dropped 13.5%, the lowest level in 7 years. And we're going down very substantially from that level. It's going to...
Yeah, have they been going down for the last 6 years?
Very, very substantial, unless you have a new administration, in which case it'll go up very substantially. That I can guarantee you. They've been doing it to you.
You can guarantee it? So you're going to work with the pharmaceutical companies to raise it? You're going to buy stock in it and tell them to spike their prices?
For years. Average Medicare Advantage premiums have plummeted 28% to the lowest level in over a decade, and that's despite everything that's been happening, which would normally make things go up.
Why would it make things go up?
And we have more...
Why? It's Medicare. Why would it make things go up? For insulin?
Then, let's see, 1,200 more Medicare Advantage plans today than we did, think of that, 2 years ago. So we have 1,200 more Medicare Advantage plans than we did 2 years ago. That's something.
You have 1,000 more Medicare Advantage plans than we did 2 years ago? Well, I've heard of senior choice, but that's incredible. Charles, where are you? I'm over here. I'm under the pile of paper that explains 1,000 Medicare Advantage plans. I can't breathe. What?
An executive order to crack down on fraud in Medicare and to give beneficiary.
I'm not committing fraud. I just didn't understand all 1,264 Medicare Advantage plans. I filled it out wrong.
Access to the latest medical devices and therapies, and to take all of the fraud money, and we're finding a lot of it, all of that.
The fraud money?
Money that we're finding in fraud and reduced prices. We provide.
Who's committing all this fraud? Who's committing all this fraud that you're seeing? Where is this fraud coming from? There's all this extra fraud money. What states is fraud money come? These old people committing fraud? Your Honor, I just don't understand which of the 1,000 Medicare Advantage plans I'm supposed to be on. I just signed my name.
Nearly $1 billion in grants to support.
Who has 1,000 Medicare Advantage plans? What are you talking about?
Home delivered meals and in-home care for elderly patients and disabled people during the pandemic. We expanded telehealth, which is really...
Yeah, you didn't expand telehealth. The pandemic expanded telehealth because somebody immediately went, you know, it's not really good if we just have all these people running in here and coughing in our faces.
Turned out to be a very hot subject, right? People that never thought about it, people that didn't like the idea, right, Tracy?
They didn't like the idea? What didn't they like about it? They like people coughing all over them?
They're loving telehealth.
Okay, my insurance is through SAG-AFTRA. They've offered telehealth for the last 2 years. They encourage it for infectious diseases. If you have a broken arm or you think your shoulder's messed up, go to see the doctor. But if you've got the sniffles and you're coughing, you go in by telehealth and you go, I've got these symptoms. And they go, okay, have you got a temperature? Take your temperature. What is it? And then you do it, and then they go, okay, I'll get you on antibiotics or what have you, or just rest and relax and whatever, and let me know if it's spiked. Like that. Like, he didn't invent this.
It's speedy and it's a lot less expensive. We expanded telehealth for Medicare beneficiaries, and the number of patients using it has increased from roughly 11,000 a week to nearly 1.3 million. So we went from 11,000 people to 1.3 million people a week.
Yeah, because you're in the middle of a pandemic, and nobody wants to go to a hospital or the doctor's office for fear that they'll catch a disease when they already have another disease they're concerned they have. What? Yeah, they've had telehealth since 1988. Good point on Isho Shell. But in all seriousness, you can iPad it. There's that place where I went and got the IV, which they have here in Vegas, where you can go get an IV and raise your, get a vitamin B IV or whatever, replenish, rehydrate, all that stuff. They telehealth you with a nurse practitioner because the person who actually puts the IV in isn't one. So you have to get it cleared by them, and they're a technician. They're like a nursing technician. It's so
big where you'll be seeing it. Price, transparency. Some people think it's bigger than healthcare. When you look at it, it's going to be bigger than healthcare.
Really? It's bigger. It is healthcare. What are you talking about? It's a part of healthcare. I'm going to build a lifeboat that's bigger than the boat. It's bigger than boating, if you really think about it.
Price, transparency.
I'm going to.
It was signed approximately 9 months ago. It's going through the process, and it'll be here by the first of the year. So I hope you're going to remember me just in case the unthinkable happens.
The unthinkable happens? I'm thinking about it right now. It's not unthinkable. Here, watch. I'll think about it. I'm going to think about it. You guys thinking about it too? Nice, isn't it? Oh, good. It wasn't unthinkable at all.
But nobody else would have gotten it. But this administration.
Thanks, William. But later, I'm only 50. I'll run for office in my 60s.
Price transparency. It's a tremendous. It's going to cut your costs tremendously. And that literally one of the biggest people in the field said, transparent. It's going to be a bigger thing. Price transparency bigger than healthcare in a true sense.
In a true sense, it'll be bigger than healthcare.
The cost of healthcare is going to come down very, very substantially.
It will? When? When's that going to happen? By the way, I know I love the idea that we are now listening you talk about a Medicare Part D payment for insulin that has existed for years, apparently, that you're maybe expanding to other people or giving them the option to expand into, and you want credit for the cost in Medicare Part D now? And you're telling me when shit's going to happen? What?
We're always working on pre-existing conditions and saving.
Are you? Yeah.
Your pre-existing conditions. And as long as I'm president, you'll always be protected on pre-existing conditions.
Yeah, thanks to Obamacare. Because you haven't been able to get rid of Obamacare, you mean? Yeah. And you're not going to be able to.
And surprise medical billing is something where people are surprised, never in a positive sense, and we've written that out, and that's going to be very quickly ended. So you're not going to be surprised, meaning badly surprised, very negative.
What is he talking? What was that? What was that? Did anybody get that gibberish? What happened? Hold on.
Always be protected on pre-existing conditions.
Okay, starting here.
And surprise medical billing is something where people are surprised, never in a positive sense, and we've written that out, and that's going to be very quickly ended. So you're not going to be surprised, meaning badly surprised, very negatively surprised. It's a big thing.
Not a good surprise. Like there's no cake involved, is what you're saying?
People go in, they go for an operation, they end up literally losing all of their money, losing everything.
Yeah, that's part of what the ACA was there to help fix, and you've been trying to dismantle it since you got in.
Over something.
And you failed, but go ahead.
That should not happen.
Really? Should the cost come down, or just let you know what the cost is and you can go, I can't afford that, kill me?
Surprise medical billing. We're using every tool at our disposal to protect our nursing homes from outbreaks. You saw the disaster of how badly some of the governors handled nursing homes. It's a disgrace what they've done.
Is it? Is it really?
What some of the governors have done is a disgrace.
What did you do?
We provided states more resources to step up inspections, added shipments of personal protective equipment to all 15,400 Medicaid and Medicare certified nursing homes.
Yeah, the Medicare and Medicaid certified nursing homes. Everybody else, you're on your own.
Issued a strict new guideline that every nursing home resident and staffer be tested immediately, and that all staff...
Yeah, this is what California did. This is what New York ultimately did. This is what Washington State did right out of the gate.
Be tested weekly. So we're making it very, very tough.
Right.
Every day of my administration, we're fighting for our seniors like never before. Our seniors are very special people. All of our citizens are special, but our seniors, would have to take care of our seniors. Our senior citizens have spent their entire lives working hard, supporting their communities and families, and paying into the system. We will not rest until they get the kind of care and support that they have earned and that they deserve.
Well, then why didn't you just pass it across the board and purchase insulin for all Medicare and Medicaid recipients and just use the power of the budget to do that? I mean, you spent $1.5 trillion on defense. What could be the cost of insulin for all of those seniors? Why do you have to pay for it at all?
Now I'd like to ask Vice President Mike Pence to come up and say a few words, followed by Administrator Verma. And I would just like to thank you again for the great job you've done. So we'll have Mike speak, and then you'll speak, and thank you very much. Go ahead, Mike. Thank you.
Thank you, Mr. President. And let me say what a privilege it is to be here.
Lying about what we've done, because we've basically taken what was in Medicare Part D and expanded it, but we're claiming that we created it. Nobody could have even imagined a price for insulin that already existed in Medicare Part D.
With business leaders and active...
I don't know where Carrot is today. I don't know. I think she should be there.
We're honored to have with us today our amazing Vice President, Mike Pence, and his wonderful wife, Carrot.
Who have been standing with you, standing with the White House Coronavirus Task Force from the very beginning. It truly has been a public-private partnership that's marshaled not just a whole-of-government approach, but a whole-of-America approach.
A corporate stock market approach.
And we see that evident today in this historic step for America's seniors. And let me join the President in expressing our profound gratitude.
I've still yet to figure out what they've done except allegedly create an option for people to opt into another version of Medicare Part D, right?
The servant heart that each one of you have
Thanks so much, Jess.
brought, and all of your employees have brought. The importance
And don't feed the trolls. I'll handle them. Just enjoy your days, guys. I appreciate it.
of today's announcement cannot be overstated, Mr. President. As you observed early on, we recognized that the coronavirus represented a particular threat to seniors with underlying health conditions, and diabetes being among them. And today's step ensures that as we continue to work to safely reopen our country, we're going to make sure that our seniors have access to affordable health care, to insulin and treatment, to be able to meet that moment along with us. Mr. President, we gather today with the news that more than 98,000 of our countrymen have succumbed to the coronavirus, and their families are in our prayers and in our hearts. But because of the cooperation and the compassion of the American people who have heeded your guidelines for America, who have listened and continue to listen to state and local authorities, we know that there are tens of thousands of American families that have been spared that heartbreak and loss. And we will express our gratitude to the American people for your incredible cooperation, the social distancing, the steps that you have embraced, the way you have
Done it even though the president has ignored it.
been willing to forfeit aspects of your personal freedom to put the health of others first. But the good news is, Mr. President, that because of the steps the American people have taken, heeding your leadership and the
they're not doing any of that stuff, and he's been encouraging them to rise up against their governor.
to state and local officials, we're getting there.
We're getting there. Oh, good. I feel so much better.
And we're starting to reopen America as we speak in a safe and responsible way. In fact, Mr. President, every state in the nation has now taken at least some steps to reopen their economies. 52 states and territories have opened retail, curbside to go with reduced capacity. 44 states, we're glad to note, have opened up elective medical procedures in hospitals and clinics around the state. 38 states and territories.
You just broadened what's considered elective.
Reopened personal care under strict hygiene protocols.
Personal care? What do you mean, haircuts?
37 states have
nail salons?
Reopened restaurants.
Yeah, tell us about the outbreak centers that came from the haircut.
34 states have reopened non-essential businesses, and the list goes on. And I think most
Thank you, Bean Toast.
meaningful to you, Mr. President, is so far 30 states and territories have reopened houses of worship under guidance of
in spite of the fact that it might kill a good section of their parishioners.
reduced capacity while allowing people to come back together in
Thanks to Jackson 81.
fellowship and prayer. This has all been made possible because
the sun shines out of Donald Trump's rectum, and that's why I'm never had a tan this good.
of the whole of government, the whole of America
Oh, is that what he's calling you now?
approach, Mr. President, that you initiated
Don't say the whole of America. It upsets mother.
when you launched the White House Coronavirus Task Force back
With Alex Azar in charge of it.
in January.
With Alex Azar in charge of it, and he had to put you in charge of it later on.
Before I step down, let me at least share.
He's stepping down. Really? You're stepping down. Is he resigning today? Oh, wait a minute. Did this get good all of a sudden?
A few encouraging words that we shared with America's governors today about the progress that we all have been making. Because to continue to safely reopen, we believe it's absolutely essential that we increase visibility by expanding testing across the country so that we can ensure that, that we can identify outbreaks where they occur. It's interesting, as you watch the daily numbers, new cases are declining around the country, and even more dramatically when you realize that a significant portion of new cases every day are actually in outbreaks in specific businesses or, as we've discussed today, in nursing homes or in meatpacking.
What? Or in meat packing plants. I love how he's like acting like, well, it's no big deal that most of them are just in certain businesses and old folks' homes and meat packing plants. You know, 2 months ago we had 15 people, and now we got 100,000 dead ones. And he's like, you know, it's just, we didn't have outbreaks in elder care facilities or meat packing plants or food preparation companies, we didn't have any of that.
Plants. But I'm proud to report, Mr. President, because of the partnership that you forged with commercial laboratories around the country.
Pence's human chloroform. There's a certain coziness to it.
14.1 million tests have been performed, and I heard again today.
Oh, I love how, look, they brought a thing. Look at that. Look how many tests. You're going to put the deaths next to it? Russia's close to us? Really? We're going to pair those numbers together? Gee, I wonder why Italy's tapering off. And look at South Korea and Brazil. How many deaths does South Korea have? They managed to have that many tests and only 258 deaths? Pathetic.
From governors across America, how they have been, in many cases, exceeding the demand in the
and I look at India's number, by the way, climbing.
testing that.
Look at Russia's. Look at the number of tests climbing. Why would you, if your numbers are going down, why would you need to test that many? I mean, if South Korea's managed to taper off their deaths and they never did anything but plateau with testing, why is this a chart to brag about?
They've made available. In fact, Governor
Indeed I do, Francisco
Murphy of New Jersey informed me that he had promised the people of New Jersey that he would be doing 20,000 tests a day. But in partnership with the federal government, as we've been providing testing supplies and accessing resources, he told me that they actually cleared 30,000 tests a day in New Jersey. And most importantly, in that state, where at one point, nearly 40% of those tested had tested positive for the coronavirus. And now the governor of New Jersey informed us that they're less than 5%.
That's because you're broadening the test. That doesn't mean the case rate's going down.
But they're hardly alone.
We always knew that there would be people who would test negative and then, oh my God.
Mr. President, 42 states are now testing at less than 10% positive rate, and 20 states.
42 tests. 42 states now have approaching 10% positive rate in the state. Remember when there were 15 cases in one state?
Are testing at less than 5% a positive
Criminy.
rate. The reality is that now all 50 states
have coronavirus in it.
The support that we've been providing, sending swabs and test tubes and medium on a weekly basis at your direction, now all 50 states have tested more than 2% of their population.
So they've tested, all 50 states have tested 2% of their population, maximum, leaving Rhode Island out of this and their weird little chart that pretended like it went down, 2%. And in that 2%, 10% are positive of the 2. So if you have a highly populous state, you're screwed.
Giving us a much greater capacity to identify outbreaks as they occur and protect our citizens. And the progress in evidence is clear. All
Is it?
across America, we see hospitalizations continuing to decline. New hospitalizations have declined steadily in the chart that you see before you from April.
Yeah, because of the big populous states are getting a handle on it. Now it's going to start plateauing just like the deaths have.
Until today.
That's what's happened.
And most importantly,
It should have, with that arc, it went from 42 to 29. That's a 10,000 drop off in that week or whatever. Look at the drop off after that. 4, and then 4 again. It's less than a third now, which means it's stabilizing because the red states are going up and the blue states are going down.
while the president often says that one loss is too many,
He doesn't mean it.
we welcome word that fatalities are declining precipitously all across the country. In fact, yesterday in America, there were just 505 Americans who succumbed to the coronavirus. And that number we hadn't seen that number in daily losses since March.
Thank you, B. Gabriel.
The reality is, because of the cooperation and the compassion of the American people, we're getting there.
Yeah. So we weren't mitigating way back there, and then we reached this peak. And the death rate started to go down in a 2-week arc from here. We went down like this. And then we reopened here. So we're basically back where we were before the peak. And then, yeah.
We're getting there, America.
Yeah, we are.
And Mr. President, at your direction, we're going to continue to work closely with states around the country to expand testing and resources.
Thank
we're
you
going
so
to
much,
continue to
Gabriel.
make sure personal protective equipment flows. But finally, what we're going to continue to do is focus on the most vulnerable. Even as we begin to see evidence that we are starting to put this coronavirus epidemic in the past,
No, we're not.
all the more we are going to continue to surge the resources and surge the kind of testing and partnership with states and healthcare providers to ensure that our seniors and anyone with an underlying immune deficiency, anyone that's vulnerable to the coronavirus,
Who knows anybody who went to the beach this weekend will be dead in 2 weeks
is immediately identified
and allowed to die quietly.
and protected by every measure that
What measure? You have a 60% asymptomatic spread with this disease.
possible.
Thank you, Scooby-Doo 55.
Mr. President, I thank you for the opportunity. We heard
The Kiss Your Ass Daily. It's the tastiest rusty trombone I've ever done in my life.
great enthusiasm from governors all across the country in both political parties today. We're making great progress, and I truly do believe that with the continued partnership that we have forged with state and local governments, with a
By Pence being on the phone calls and Trump not being allowed.
tremendous efforts of our healthcare workers around America, and with God's help, we will reopen America. We will continue to reopen our country safely and protect our most vulnerable as we do. So thank you, Mr. President.
Thank you, Mike, very much. And I think I'll just add on to what Mike said. If we didn't
Oh no. Don't. He was a little politically sane at the tail end of that. Just leave it. Just leave it.
act quickly and smartly, we would have had, in my opinion and in the opinion of others, anywhere from 10 to 20 and maybe even 25 times the number of deaths.
If you didn't do anything, stop taking credit for what would have happened if you actually did nothing. Unless you consider that an option, shut up.
We closed the border to China, meaning we put on the ban, people coming in.
No, you didn't. 40,000 people came in, and that doesn't include anybody who bounced through another country. Plus, it only applied to non-resident visas that were new. Plus, it had nothing to do with Europe at that point. You didn't lock people out of coming in from Brazil until last week.
From China. That was a very big moment.
Was it? Because everybody was like, why do you think that's enough? Why are you going golfing now?
As Dr. Fauci said, we saved thousands and thousands of lives when we did that.
Yeah, and you let tens of thousands die by not starting mitigation a week earlier. You had to be talked into that. By the way, nice Coke bump.
And that's true, but I think we would have had anywhere from 10 to 20 or 25 times the number of deaths if we didn't act.
If we hadn't done anything.
The way we did. And also.
You mean the people? If the American people hadn't sheltered in place and stopped this thing in its tracks?
We didn't act swiftly. So we're very proud of our team and our task force. And Mike, great job. Seema, please.
Yeah, you can always tell he farts when he moves his jacket.
Afternoon. I want to start with thanking the one person that's responsible for today's announcement, and that's President Trump.
Is he really? Is he really? Since you're expanding Medicare Part D, maybe the people who crafted that bill might want to bring them on board since you're just copying it. And apparently it's not a mandatory expansion. It allows people to choose from another 1,000 plans that might have one in it.
He's been steadfast in his commitment to lowering the cost of drugs and protecting the Medicare program and making
insulin isn't a drug.
Sure it works best for seniors. The president also knows that it's the free market that leverages competition and negotiation,
It is? The government just negotiated this price. What are you talking about?
What can lower cost and improve quality for the American patient.
This isn't a free market thing. This is government intervention.
And because of that, we've been working to slash Medicare's anti-competitive regulations, and it's worked.
Anti-competitive regulations?
In the Medicare Part D program, as the president said, we are seeing low premiums, a 7-year low. And in the Medicare Advantage program, we're seeing a 13-year low.
Non-model Part D plan, average out of cost. Model Part D plan, average savings. Stable, predictable cost. All estimates and averages are based on beneficiary out-of-pocket costs from 2018 CMS prescription drug event data, inclusive of the majority of rapid, short, intermediate, and long-acting insulins. Costs are calculated only for non-low-income, subsidy, non-U.S. beneficiaries. An enhanced alternative standalone prescription drug plan and Medicare Advantage plans that offer prescription drug coverage. Individual savings may vary. Holy smokes. You think there's enough legalese at the bottom of this one? Like, Burks is going to need to, up her chart game to compete with the amount of bullshit in this one. Individual savings may vary. Look how small that is. I'm glad they put it in big type since it's for old people. Well, yeah. Why is this special unless it's available across the board for Medicare? This is non-model Part D plan, model Part D plan. Deductible, initial coverage, coverage gap, and catastrophic phase. So the deductible part, you've dropped off for the non-model Part D. What? How is this not the same? What? How are you comparing non-model Part D plans to model Part D plans? What is this? What the shit is this?
In premiums. So we're putting money back in the pockets of seniors. And that means...
How? Only if they opt into the Part D.
$3 billion in savings for patients and $6 billion in savings for taxpayers. And in absence of a congressional solution, we applied those
stupid Congress
same principles to lowering the cost of insulin. We are waiving Obamacare laws that disincentivize plans from lowering cost sharing for our Medicare beneficiaries. And this is important because we know that beneficiaries struggle to pay their insulin costs. It's patients like Cindy from Rochester, New York.
Oh my God, we're getting an anecdotal story. Cindy, what about Gwen?
She told us
I didn't realize she was getting sandwiches from Humana.
that the high cost of insulin
It's a Humanowich.
has impacted her health and that she's been forced to ration her insulin. She said,
Right? That's been a problem for a while. Everybody's been trying to fix this. What's the difference here? If she can't afford the Medicare Part D additional costs, is she in the plan at all?
I know that it's not good at all for my health, and I'm sure that I've affected some organs negatively because of that lack of money to purchase insulin. But no longer, thanks to the President's leadership, Medicare seniors will pay no more than $35 for their insulin, and that's per month, and that's for all forms of insulin through all phases of the Medicare Part D program.
Compared to non-Medicare Part D. No shit. What are you talking about? If you opt into Medicare Part D, that's what it was there for.
I also will say that some plans are free to even go below the $35.
Yeah, the catastrophic ones if you're in poverty.
And so they could even see lower premiums as well.
If they have no money.
I'm also
We've already had that.
proud
That's
to
what the catastrophic thing was. If you'll notice, even in the non-Medicare Part D, it says 35 and lower. Shall we take a look? Should we go back to what you were saying? Should we go back to your little chart? We do that? Hold on. See that? Catastrophic phase on the non-Medicare Part D. Catastrophic phase on the Medicare Part D. The Model Part D plan. Non-model, catastrophic phase. Model, catastrophic phase. 35 or less. Same exact frigging thing. Oh, we've got video though.
and the health plans for stepping up to the plate, for coming together to negotiate this great senior savings model. It's going to make such a difference to the lives of many seniors across the country. And I am optimistic that this could be a...
Does anybody know what the model Part D was beforehand? Was it? It seems to be the same.
Model to lower the cost of many other drugs in the Medicare program. And thank you again.
Okay, name them, do them. Let me see. This is all, we've clearly seen this is bullshit. Show me the ones you're actually changing.
President Trump.
What about statins? What about, like, hydroxychloroquine for lupus patients? What about people with rheumatoid arthritis?
For bringing lower cost priced insulin. Our seniors are going to be saving an average of 66% in their insulin cost. And this is nothing short of a godsend. And with that, I think we're going
Oh, I see. Trump is a godsend.
to hear from one of our Medicare beneficiaries. Thank you.
Right.
Oh, we're going to play a video.
Thank you, Seema.
Hi, my name's Alan Artfield.
Hi, Alan.
I live in the Hudson Valley in New York. I'm 68 years old and I rely on Medicare Part D. I've been a diabetic for over 10 years. And during that time, I've watched insulin prices rise dramatically. I pay $400 a month now for insulin. I appreciate President Trump putting a policy in place that will help people like myself for the future as far as insulin products. Thank you.
That's very nice. And many
Very nice for him to thank me particularly for this.
people feel the same way. They can't actually believe it. $35 and less. And less.
It's $35 and less in catastrophic circumstances. What do they have to do to prove they're in a catastrophic circumstance? Not be able to afford it?
And they were being ripped off at a level that nobody's seen before.
No, people who paid that amount were the well-to-do people on Medicare Part D who had the economic viability able to do it.
But that's true with a lot of other things, and we're taking care of them too.
Are we?
So I want to thank everybody for being here, in particular these great executives. Thank you very much. Thank you very much. You were very impressive in your speech, by the way. Thank you very much. John, please.
Mr. President, can you tell us what you plan to do regarding sanctions against China for its pending actions against Hong Kong And do you also intend to put
We're not happy. They should have stopped it at the source, but they didn't.
restrictions on F and J visas for students and researchers coming into the United States from China?
Your question's early. We're doing it now. We're doing something now. I think you'll find it very interesting, but I won't be talking about it today. I'll be talking about it over the next couple of days, John. Okay? But it's a very important question. Yes, please.
So we're going to announce that we're not allowing student visas and work visas in from China.
Anybody?
Starting tomorrow, day after tomorrow.
Yeah, please.
Mr. President, two questions about a couple of things you've tweeted about in the last few days.
Oh, God.
Were you meaning to criticize Vice President Biden for wearing a mask yesterday? And can you explain why you've been tweeting about a conspiracy theory that has been proven to not be true?
No, Biden can wear a mask, but he was standing outside with his wife, perfect conditions, perfect weather. They're inside, they don't wear masks, and so I thought it was very unusual that he had one on.
They were passing other people. They had other people opening and closing their doors. They had different groups. They had, they didn't know who they were going to encounter. You're going outside. You're in public. It's also setting an example, dummy.
But I thought that was fine. I wasn't criticizing him at all. Why would I ever do a thing like that? And
why would I ever, Sleepy Joe, why would I ever make fun of someone?
Your second question was? I couldn't hear you. Can you take it off because I cannot hear you?
I'll just speak louder, sir.
Oh, okay, good. You want to be politically correct. Go ahead.
No, sir.
No, he's trying. They're all sharing a mic, dickhead.
Just want to wear the mask.
Go ahead.
The second question was about your tweets about the woman who died, who you're suggesting that Joe Scarborough was responsible.
Yeah, a lot of people suggest that.
Assholes.
And hopefully someday people are going to find out.
They did find out. She had an aneurysm. She hit her head on the desk. She died. No one was there to save her. She didn't get medical attention. That's why she perished. By the way, tell us about the 13-year-old you spent some time with at the behest of Jeffrey Epstein.
A very suspicious situation. Very sad and very suspicious. Question, please.
You know what's suspicious? All the videos of you joking with Jeffrey Epstein.
I've asked you not to tweet about it anymore, sir.
Mr. President, though, have you seen
skipping that
letter that was written by her husband begging Twitter to delete your tweets, talking about how hard it's been for his family, for him to deal with
but
that?
I'm sure that ultimately they want to get to the bottom of it, and it's a very...
And if anybody knows where the bottom is, it's Donald Trump, and of course there is none.
Serious situation. I also saw a clip with Joe and Imus where they were having a lot of fun at her expense, and I thought it was totally inappropriate. No, it's a very suspicious thing, and I hope somebody gets to the bottom of it. It'll be a very good thing. As you know, there's no statute of limitations, so it would be a very good...
On murder, right. Okay, so he's suggesting that Joe Scarborough murdered a woman in his office and got away with it. And I guess that's how you get an MSNBC show, is what he's... Yeah, this is how it's operating now. We do realize that Scarborough was a Republican, right? They used to be buddies. By the way, Joe, this is what you get for giving this dude free airtime for 2 years leading up to the election. I feel bad for this guy's widow and her family, or for this woman's widow and widower and her family. But insofar as Joe Scarborough goes, dude, you helped make this.
Yeah, very good thing to do. Okay, who's next? Any questions on insulin? Yeah.
Yeah, explain insulin. Tell us what you think insulin is.
Please.
What's insulin?
Mr. President,
Where is it made?
there's a bill in Congress that's related to the Uyghurs. It passed the Senate. It's going to be up in the House. Are you willing to sign that?
We're taking a look at it very strongly. They're going to report this afternoon. I'll be looking at it this afternoon.
Something special
Yeah, I don't know what you're talking about.
that you mentioned on China, does that include sanctions,
No,
or does that?
it's something you're going to be hearing about over the...
It's cute. We're going to unveil it. It's kind of like a bachelor thing. I'm going to give China a rose and say thank you very much.
Next, before the end of the week.
We'll see if what we're trying to do is I'm waiting to do this while my family renegotiates our debt with China, and if I'm able to get funding from Deutsche Bank to pay off the $200 million in loans I got from the Chinese, then I will put sanctions on all kinds of stuff. But if we can't get out of that, then I'm going to say that they've done a great, fantastic job.
Very powerfully, I think. Yeah, please.
Yeah. Is there any reason why someone who does not have diabetes would take insulin? Is there any sort of medical reason for that?
I could ask that
Oh my God. Are you trolling him?
question to anybody like to discuss that? Do you want to discuss it, please?
No.
Go ahead. Do you know the answer?
No.
Either one of you or both?
No, dummy. The answer is no.
Come on, let's get these highly paid executives up here to give the answer.
They're not medical doctors. The answer is no.
Seema?
You produce insulin. He's asking you. Seema, anybody want to take the bait on this incredibly stupid question that I can't even mentally process?
Please, Jerome. We picked a good one. We got it right.
Well, thank you, Mr. President.
you.
And I think it's important for everyone to know that, as Tracy Brown highlighted earlier, 1 in 3 Americans is actually either diabetic or pre-diabetic. And I would encourage folks to go to diabetes.org/risk-test. So diabetes.org/risk-.
The short answer is only people with diabetes should be taking external insulin. And if bodybuilders do it, then they're doing it off label like they do steroids.
Test to find out if you are at risk for diabetes. As far as insulin goes, we know that, again, 7 million people actually are dependent on insulin.
Why?
Know that from a type 1 diabetes standpoint, 1.6 million Americans have type 1 diabetes, and most all of them are dependent on insulin. Your body, Mr. President, actually makes insulin. And
this is the first time he's hearing this, by the way.
It does. I probably make plenty. I could probably be an insulin factory. They could just hook a tap up to me. Is it orange? Is that what's coming out of my face?
Endogenously, and people such as you and I, we make our own insulin. So yes, we do utilize insulin, but we make it ourselves.
He's literally just learning this. Did you hear that?
Other people who have diabetes oftentimes need exogenous insulin made by many of these great manufacturers.
Is exogenous more expensive than exotic insulin?
Here, so that they can be healthy and live long and successful lives. And make no mistake about it, if they can get affordable insulin, they can live a long and healthy life. And that's what we're here for today. Today is a very important day. It is
for a very small segment of the people in the United States that need insulin.
Monumental day, because Tracy, we've been working for years to try to address the price of insulin. For years. This is an important day, and I want to thank you, Mr. President, and I want to thank all the people here for making that insulin affordable to more people.
Thank you very much. And Tracy, do you agree with that?
Do you agree with that? What do you mean, do you agree with that?
And
please, try your own answer on this. Try to sound smart, please.
Question I found to be a very interesting one, but...
Really? I think he was fucking with you.
Is that an unusual question or an unusual circumstance?
Is it unusual for an adult man to not know what insulin is?
I'm not sure that it's an unusual question. There are many.
I think it's unusual that a grown man doesn't know that your body produces insulin.
People who are not clear on what causes diabetes and actually what it means.
Okay, good. I thought it was a very good question, actually.
Yeah, because you didn't understand it?
Please, go ahead.
Thank you, Mr. President. We see in Europe slowly from one country to the other, they are opening their borders and letting people going from...
letting people going.
Moving from one country to the other. Are you considering...
Very sexy. This whole conversation got very sexy. They're going, these people. They're coming and then they're going, like Europeans like to do.
For the good of the U.S. economy, are you considering lifting the flight ban from Europe in the next weeks?
Well, we're just putting a ban on,
we're looking at,
as you know, going on immediately, essentially, almost
Brazil.
immediately, to Brazil.
On Brazil immediately, but almost immediately, going on looking immediately.
From Brazil into our country. So from Brazil to the United States, they have an...
So if you're in Brazil and you've got a slight cough, better catch the next flight because it hasn't happened yet.
Very hard time in Brazil. We'll be doing certain announcements on other countries, including Europe, as we move along, and where they're making progress, we'll start to open it up, but only where they're making progress. They're making some good progress. I think we're making very good progress. We're making very good progress on the economy. The numbers are better than anybody would have anticipated. And certainly I think that's been reflected in the stock market, which had a very...
No, the stock market is because rich people are shuffling their money around to take advantage of a dip in the stock, and they think this is going to be a V. A bunch of people who think this is going to be a V are people who have a lot of cash sitting around because they sold, like Loeffler and all these assholes, and Burr, sold before based on information that they had that they knew you were going to cock this up, and now they're buying in for the growth.
Big day, and it's over 25,000. And when you think 25,000 is a very high number, when you think that it was at 29,000 and now it's at 25, that's a very big day. It's up very substantially over the last 6 months. So
yeah, so if you lost your job and you're getting food from a food bank and all that stuff, at least you can know that the stock market is up.
We had a very big day, but people are seeing what's happening. They're seeing there is a pent-up demand, as I was predicting.
For what?
And you're going to see it more and more. We call it the transition to greatness, and it really...
Yeah, that's a stupid phrase. Make T-shirts, though.
We're going to have a third quarter that's going to be good.
By the way, thank you guys for tuning in. Sorry I was late starting today. I will be flying tomorrow, so depending on how I arrange this, I don't know that I'll have a show, or if I do, it'll be very late. So tomorrow, probably no show, but then I'll be back on Thursday, and because I get to get my kid tomorrow. I'm very excited. I will check in on social media with you guys, though, but I appreciate all the support and patrons. I love you. Thank you for helping make this possible. And everybody who's super chatting today, thank you so much. I appreciate it greatly.
We're going to have a fourth quarter that has the potential to be really good, and we're going to have the best year, one of the best years we've ever had next year. That's what we see. Yeah, John, go.
Yeah, once you're out.
Mr. President, is it your intention to bring American forces home from Afghanistan by Thanksgiving Day, and is the Pentagon drawing up plans to that effect?
Well, I think everyone knows we're down to less than 8,000 troops. We're with leadership in many different fields and in many different parts of that country. We're dealing with the Taliban. We're dealing with the president. The president now has gotten himself straightened out with the two
Thanks for the subscription.
presidents. But we're dealing with, because they had, as you know, they had competing factors and factions.
Did they?
Yeah, I think we want to get
competing factors. Was one of the competing factors the group that went into a maternity ward and shot the place up?
They're 19 years. We're really not acting as soldiers. We're acting as police. And we're not sent over there to be policemen, but we're there 19 years. And yeah, I think that's enough. And they understand. We're having very positive talks. We want to bring our soldiers back home. We want to bring them back home. And we're not only talking about there, we're talking about other countries also. We bring our soldiers back home. We can always go back if we have to. If we have to go back, we'll go back, and we'll go back raging. And there we'll go back as
raging. Great.
Warriors, fighters. But right now we're policing, and we're not meant to be.
Basically, we're pulling the troops out so we can just air bomb the place.
Police force. We're meant to be a fighting.
From now on, it's all drones and Moabs.
Force.
Is Thanksgiving Day the target?
No, I have no target, but as soon as reasonable.
I don't have a target. As soon as, eventually, right? Something in a very short period of time. Right after you guys look into Joe Scarborough and my taxes come out and the healthcare plan comes out, and we finally get rid of Obamacare and we have a cure and hydroxychloroquine turns out somewhere around there.
Over a period of time, but as soon as reasonable. We're down to 7,000 some odd soldiers right now.
Oh, some people left just while we were talking.
And in Iraq, we're down to 4,000 soldiers. So we're making a lot of progress. In Syria, you remember, John, on the border, when I took the soldiers out of the border, everyone said, oh, that's so terrible. Well, I spoke to President Erdogan yesterday of Turkey. The border's been fine without us. They've been policing that border for 2,000 years.
Yeah, who cares if they just kill a bunch of Kurds? You know, we just listen to them.
All of a sudden, we had thousands of soldiers.
We can trust that guy. He beat up Americans on our own soil.
They're doing their work for what? Guarding Syria and Turkey on a border, a very long border? No, we want our troops back home. We took
Yeah, besides Russia wanted those bases.
them out. That was a year ago. I was criticized. Nothing happened.
Nothing, just some dead allies.
Except they're watching their own borders now. We kept the oil, but at some point we'll take care of the Kurds with respect to the oil and get out.
What are we going to do, pour oil on them and then toss a match?
Yeah, please, go ahead.
Mr. President, quickly on your meeting with Governor Cuomo
Yes, Scarborough can sue Trump.
tomorrow.
Yeah, he's coming in.
Can you say what
Thank you, Melinda.
you're going to be discussing? Do you have a particular agenda? Do you think you'll discuss the Gateway project, the Hudson River
I would
Tunnel
imagine
project?
we would, but he asked for the meeting, so we'll see what he wants. But he asked for the meeting. Governor Cuomo, and we'll be coming in sometime tomorrow. Yeah, please, go ahead.
Yeah, they know that. What, you have no idea.
What can you tell us about the documents reportedly declassified by Rick Grinnell just before he stepped down as DNI? Are you prepared to release the transcript of the Flynn-Kislyak conversations?
Yeah, I'd like to hear it, too. I mean, I'd like to hear it. The FBI, as you know, said that he didn't lie, and certainly the
No, they didn't.
conversation.
Flynn said he lied. Why would the FBI say he didn't lie if it did?
Almost regardless, it was a
Why is the FBI contradicting the guy that their case is against?
good conversation. He was allowed to do it. And the Mueller people who...
Then release, here's the way to solve it. Release the grand jury testimony, everything from the Mueller investigation. Case closed. Solve it.
are have been proven very
What have it been proven?
bad. Very bad things they did. Very bad things. A lot of bad things are being found out about the hoax. Greatest hoax in the history of our country.
Then release the entire transcript, release the unredacted Mueller report, and release the grand jury testimony then.
And it was an illegal hoax and a very dangerous hoax. And a lot of bad things.
Then release all of it. Release all the info. I mean, what then if it's a total hoax, if it's the greatest hoax ever, if it's all a hoax, release the grand jury testimony.
Been found out about
for the good of everyone.
Mueller and the gang. So I would like to hear that conversation. Yeah, I would like to hear it personally. So whatever they want me to do, I'll do. I think Rick Grinnell has done an incredible job.
Release it.
And things are happening now that I always knew this was the answer. This was an attempted coup.
What? No, it wasn't. If you're removed, they don't take power. Mike Pence would be in charge. You not know how coups work?
By a bunch of dirty cops and others. These are dirty.
They don't get in power if you get out. This isn't. All right.
Cops, dishonest slime bags. All right. Yeah.
Slime bags.
Question. Go ahead, Jeff.
Release Brian.
Thank you, sir.
No, it is not Biden.
Mr. President, on Friday you announced that you wanted governors to reopen churches and synagogues and mosques, and you said you would overrule them if they declined to do so. Can you explain what authority you had in mind when you said that you would do that?
I can absolutely do it if I want to, and I don't think I'm going to have to because it's starting to open up. We need our churches and our...
Explain how. How can you do it? And by the way, as a Republican who believes in states' rights, how do you do it? How is your party okay with the president having the ability to override governors' rules in their individual states?
Synagogues and our mosques, we want them open. Churches, synagogues, mosques, and other. We want them open, and we want
them
open as soon as possible. Now, I can tell you, I know a lot of pastors, a lot of rabbis, imams, and they want to take care of their people. They want to.
Yeah, one of the ways you take care of your people is not gathering them during a pandemic, especially when a good portion of them are older, as the very religious in this country are, and are in danger of dying from it.
They don't want anyone getting hurt or sick, and they're going to take care of their people. We need these people. We need people that are going to be leading us in faith, and we're opening them up. And if I have to, I will override any governor that wants to play games. If they want to play games, that's okay, but we will win.
They're playing games. They're playing games because they don't want groups to gather over 250 and they're afraid people will die, or 50 or whatever their standard is for their state. And they're playing games.
And we
the game of life. And if I want to spin it and get a free kid.
Many different ways where I can override them.
How? Name one.
And if I have to, I'll do that.
Try it. Try it. Please do. Please be the president that allows all presidents going forward to override the rule of law in individual states.
But we want our churches and our synagogues and our mosques, etc. We want them open.
Etc. I belong to the Church of etc. By the way, if you didn't know, or whatever. I have to say though, the sermons get a little boring. They tend to go on and on and on and on, etc., etc., etc.
Now there may be some areas, by the way, where
where witchcraft
or whoever may feel that it's not quite ready, and that's okay. That's okay.
Well, then that's what they're doing.
But let that be the choice of the congregation and the pastor, John.
No, because if you have one group over here that is for it and one group over here that's against it, the group that's against it is put in danger by the group that's for it, and it's not evenly displaced. And then you have a bunch of old people who go to this church, and they're a bunch of Lutherans, while the evangelicals decide it's time to go back to church, and then they spread it to everybody, but they know everybody because they're all basically the same crowd, same age group, and all that kind of stuff. And these folks clog up the emergency rooms, and if this group over here has a heart attack or diabetes-related complications, the hospital beds are all full of these assholes over here who thought that they could inject bleach into their lungs, praise Jesus, and pass the ammo.
Mr. President, how long will you give North Carolina Governor Roy Cooper to provide you with the information that you and the RNC are asking for before you decide to look elsewhere for a venue for the RNC convention in August?
Well, as you know, we don't have much time because we have to know that if we're going to spend millions of dollars on an arena, we want to be in North Carolina. I love North Carolina. I won North Carolina. We just had
We need to win it again, and my numbers aren't looking good, so we have to have it there.
2 races that we won recently for Congress in North Carolina. 2 very big races that the press didn't want to report on. If we would have lost them, it would have been the biggest story in political history. But we just won.
Because it's a hugely red state. You should win them easily. It would be news if you lost.
2 races. It's a very important place.
And they aren't you.
To me, I love North Carolina. In fact, my son, Eric.
Oh. Yes? Tell us about Rudy Jr.
Laura named a baby Carolina. And
really? He named it after what? Wait. He named his child. So he's sort of the Kanye of the family? Is that what we're doing?
From, I think, both. But she was born.
I think you named after both Carolinas. Oh, God.
In North Carolina, as you know, Laura. So it's a very important place to me. But at the same...
Not named after South Carolina then, because she was born in North Carolina. So they named it after Carolina so they could keep track of where they were born. They couldn't just write a note down. Where were you born again?
I think the people understand this. We have a governor that doesn't want to open up the state. And
yeah, because he's afraid for the people who live there.
We have a date.
You don't give a shit. Oh, no, they have a date with the president. Well, if he smells like Tic Tacs, cover your groin and run.
Of August, in the end of August. And we have to know before we spend millions and millions of dollars on an arena to make it magnificent for the convention.
Magnificent. 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 You mean hook up some balloons and have some tapestries and use the screen that they make available if you buy the whole convention package?
And we have tremendous people. I mean, the economic development consequences are tremendous for the state. We have to...
Yeah, imagine what will all the gay prostitutes do if they don't have enough lead time to buy their plane tickets by mid-July?
Know that when the people come down, they're going to have the doors open. Now, if the governor can't tell us very soon, unfortunately, we'll have no choice. This has nothing to do with us. This is between the governor and North Carolina, and the people of North Carolina. But the people want it, and we'll have to see whether or not the governor. Now, he's a Democrat. And a lot of the Democrats, for political reasons, don't want to open up their states. So we'll see if
The political reason? You mean they don't want their voters dead?
that works, but I don't think it will.
Is that a political reason?
I'd love to have it in North Carolina. That was why I chose it, Charlotte. But we're going
Why?
to see. We're going to see. And at the end, we need a fast decision from the governor. He's going to have to, because he's been acting very, very slowly and very suspiciously, but we'll find out.
Very suspiciously. It's almost as if he's in a pandemic where they don't have the ability to contact trace or test more than 2% of their population.
Question, please.
So in terms of soon, are we talking a week, 2
Well,
weeks, a month?
yeah. I mean, we can't take, we're talking about a very short period of time. It's a massive expenditure, and we have to know, yeah, I would say within a week. That certainly we have to know. Now, if he can't do it, if he feels that he's not going to do it, all he has to do is tell us, and then we'll have to pick another location. And I will tell you, a lot of locations want it. But I picked North Carolina because I do love that state, and it would have been a perfect place for it, and it still would be. But he's got to say that, you know, when thousands of people come to the arena, that they'll be able to get in. Does that make sense? I mean, you know.
No. They can get in. You're not going to be able to have a convention there. Anybody can get in.
We'll spend.
Why would they want to get in if you're not having it there? That's what they show up, and 3 months ago we moved it to Arizona, but they're like, "Let me in, I insist."
Millions and millions of dollars on this magnificent design, but
Oh yeah, is it Stonehenge kind of a thing? Did you draw it on a napkin? Make sure you put feet instead of
in the end, they have to be able to get in. I don't want to have it where we get there and then they announce, after all the money was spent, all the work was done, all the people travel in, guess what? You can't put anybody in the arena, or you can put a tiny number of people in the arena. We can't do that, John. Yeah.
Well, they don't know if there's going to be a resurgence. Can you guarantee there's not going to be a resurgence? No.
Please, go ahead.
Go ahead, John.
There are now more than a dozen states in this country where case numbers are rising. So why is it suspicious if a governor says, look, we don't want to move that quickly. We still think we need to shut down?
Oh, I think it's fine. They have to do it. Look, the governors in certain ways have to do what they want to do, but they have to tell me what they're doing. And when it comes to churches.
Yeah, they don't know. Because they don't know. They don't have the figures. They don't have the swabs. They don't have the test kits. They don't have the ability to contact trace.
Etc. They will be overridden by me. When it comes to other things, and, you know, many other things, they won't. If I think something's being done incorrectly or wrong, I'm going to do it. But
oh yeah, incorrectly or wrong? Like if they're misusing insulin, for example?
You have different governors, and they have very different views.
I still can't get over that he doesn't know where insulin comes from or that he makes it with his own body. Did you hear? I mean...
Where they are and where they're going. So we'll see what happens. Please go ahead.
I'm sure you saw the
We'll see what happens. Do we have a tally of how many times he said that?
images from over the weekend of people out on Memorial Day weekend. They were crowding pools, crowding boardwalks. Do you have any message for those people?
Yeah, always.
Yeah, we've got to get our country open. America first, so cough on your neighbor.
Be safe. You want to be safe.
We got to do herd.
We're opening up, but you want to be safe. Go ahead, please.
Thank you. About mail-in voting.
A little late for that.
You've been speaking out against that a lot.
You mean mail-in voting?
Yeah,
Not
you've been
ballot.
speaking a lot about that.
Yeah.
Why should somebody who is afraid of getting coronavirus, going to public places, standing in a line, etc., why should they
First
not?
of all, yeah.
Why should they not be allowed to mail in?
Well, that's going to be in a long time from now. Number one, it's quite a ways away.
Yeah, but you have to request a mail-in ballot beforehand, and we don't know about the second resurgence. Thank you, Joe Carter.
Number one, but when you do all mail-in voting ballots, you're asking for fraud. People steal them out of mailboxes.
They sign somebody's name. All of them say Carlos Mencia. You can't trust that guy. Ned's his real name anyway.
Print them, and then they sign them, and they give them in. And the people don't even know where they're double counted. People take them away.
They're double counted. Somebody gets a list, and they see the same name come by 4 times. Like, well, I guess he gets to vote 4 times.
They force people to vote. They harvest.
They force people to vote.
What harvesting is, they take many, many ballots and they put them all together, and then they just dump them, and nobody has any idea whether they're crooked or not. Look, you do
whether they're crooked or not.
mail-in voting. Now, it's another thing to do absentee voting. Or if somebody has a medical condition where they go through a process and they get an absentee ballot, that's okay.
A process? What, do you got to go get a doctor's note to have a medical reason?
That's different. But in California, the governor sent, I hear, or is sending, millions of ballots all over the state. Millions.
No, you don't. No, they're sending applications. You can still vote in person. The other thing, too, is you can get your vote by mail ballot and fill it out and then drive to the polling place and drop it off rather than stand in line.
Anybody.
He's going to lose, and he knows it.
To anybody.
This is to fight the. This is his protection when he loses.
People that aren't citizens, illegals, anybody that walks in California is going to get a
Anybody that walks, illegals will get a vote. No, they won't.
ballot. We're not going to destroy this country by allowing things like that to happen. We're not destroying our country.
Who are these people?
There's more to do with fairness and honesty and really our country itself. Because when that starts happening, you don't have a fair, you have a rigged system. You have
Okay, so it's rigged that when he loses. Oh my God.
a rigged system. And
That's what's going to happen. I like his claim. I mean, this is just basically to cover. He's losing by 11 points. Rigged, the most rigged it could possibly be. Rigged. What do we have? Like 9 cases of people doing like real voter fraud, and half of them were accidents, and they still did time.
that's what would happen.
Who the hell is going to harvest when you can get 5 years per count for voter fraud and for mail fraud? Who's gonna line up to do that for the Democratic Party?
So mail-in ballots, and the governor of California did better than any that I could ever do in terms of explaining when he sent out or will send out, and I don't know, I think it's maybe partially already done, millions and millions of ballots to anybody in California that's walking or breathing.
No, you have to be a registered voter. There's no toddlers or teenagers below the age of 18 that are going to get any. There's no non-citizens that are going to get one.
Many of those people don't have the right to vote.
Well, then how do they pass the registration process?
They'll be voting.
How? Where do they show up?
And
what voter registration do they show up on where they get one, and when they receive the vote, they check it against the list, and it matches?
You know what? We're not going to let it happen because you're subverting our process and you're making our country a joke. And
yeah, that's who's doing it.
Democrats are doing it because in theory it's good for them, although last week we won 2 big races. We won in Wisconsin and one in California.
And there was a bunch of mail-in voters, so why aren't those fraudulent? Are you saying people harvested ballots and wait, are Republicans harvesting ballots? Do we need a recount?
We won a tremendous race in California. That was interesting because at the end of the race they brought in the Democrat governor, same governor. He brought in voting booths, not mail-in voting booths, because they were losing. They saw that through the ballots. But no, you can't do that. You can't do the mail-in ballot.
Where they just set one up later in the day?
It's because you're going to have tremendous fraud. And remember what...
Oh my God, there's not enough. You do realize that if you have a booth and there's no voters to use it, it doesn't print votes.
I said, they'll be grabbing them from mailboxes. They'll even be printing them. They'll use the same paper, the same machines, and they'll be printing ballots illegally.
So you do have a UPC code that has to match the one that it's counted against, right? You do realize that.
And they'll be sending them in by the hundreds of thousands, and nobody's going to know the difference. We can't.
How? What kind of cartoon does this man live in?
Do that. You want to vote? You really have to. Absentee is okay. You're sick. You're away. As an example,
you're afraid that there's a COVID outbreak and you don't want to die.
I have to do an absentee because I'm voting in Florida and I happen to be president. I live in that very beautiful.
You don't live in
house over there that's painted white.
Where is he right now? Isn't it behind him? Where's he pointing?
So that's okay. And it's okay for people that are sick and they can't get up, something.
They can't get up.
But
Uh-oh, they can't get up?
once it was reluctantly aroused, it was hard to get it aroused, and it is hard to get it aroused, but we got it aroused. Voting is a great honor. It's a great
Right. And it's a right.
honor. And
It's a right.
people love to go out and vote, and I want to keep it that way. And if we don't keep it that way, we'll have nothing but a rigged system in this country. We can't do that. Thank you very much, everybody.
That's his walkout line. See ya. Oh my God.
Thank you very much.
No, we're not doing this twice. Forget it. You guys, by the way, he votes by mail. He's also currently committing voter fraud because he is registered to vote in Florida, but his Mar-a-Lago, which he lists as his home address, when he purchased the property to turn it into a club, he signed a contract with the state that it could not be a residence. That if you have a property, it can be a club or it can be a residence. It cannot be both. It is a club. He still has people come to the club. If they're converting it into a residence, they have to file that way. They have not done that. So he is listing his residence fraudulently in the state of Florida. By the way, he's allegedly a billionaire. Why wouldn't you just buy a $40 million house in Florida or some nonsense, some crazy show-off number, and say, I'm moving down there? If you're moving from New York. Does that make sense? Like, thank you, Natalie. Hi. That part's absurd. He is not registered to vote in Florida properly. He is committing voter fraud currently. And I don't know why nobody pushes back against that. Like, any reporter could simply go, Mr. President, when you created Mar-a-Lago as a club, you signed a contract with the state that it can be a residence or a club, but it cannot be both. Are you converting Mar-a-Lago into a private residence and shutting it down as a golf resort? If you are not, then where are you registered to vote? You do not have a residence in the state of Florida. What gives you the right to vote in Florida? How do you super chat? Is that on Twitch? I downloaded it. Go by my new. Oh, hi, Hollyberry. That's on YouTube. But thank you so much for even thinking about it, and I appreciate it. Thanks, LEC, and thank you, Natalie. I don't know why nobody asks that. Does anybody? There's tax ramifications between a club and a restaurant, a residence. Yes, that's why they sign that. You know why they agree to that difference. But it's a very specific thing. You cannot live there, and I don't know if it's like live there full time or you can use it as. If there's timeshare rules where because I don't think you can. I don't think they can sell residencies to other people too. So that's the thing. So if other people can't buy a place there like it's an apartment building, neither can you. It has to be a hotel and a club. So I don't. Currently, Donald Trump is committing voter fraud. Period. He is currently lying about his state of residence and his place of residence, and has registered with the intent to commit fraud by mail. Come at me, bro. Prove me wrong. That's all there is to it. It's very strange, and I don't know why nobody pushes back against him on this. I'm going to sign off now and finish unpacking a bunch of toys for Cam because he comes in tomorrow. And thanks for the peeps, Natalie, and I appreciate you guys. And thanks for hanging around later than usual. Like I said, I'll check in tomorrow. I won't be doing this kind of like stream along. I might just hop on. I will have some free time midday when I'm alone in an airport for a couple of hours. So I think I will bring my iPad with me and just do a live stream hanging out with you guys, which would be fun. I'll find a little corner and yak with you guys. And but I adore you guys, and I'm curious if anybody can hunt that down and find out why nobody on a reporter level has pushed back against the fact that he is not properly registered to vote in Florida. He is in the process of committing voter fraud. I don't know why nobody brings that up. It's not shocking. They let everything slide. That's where the whole Teflon Don thing came from. Just going to change drastically as soon as he's out of office, by the way. But honest to God, I don't get when he starts complaining nonstop about, it's just people are gonna fake their votes and they're gonna sign things and copy them and send them all and all that BS. He is in the process of committing voter fraud. Donald Trump is right now in the process of committing voter fraud. Anyways, thank you guys for joining me today. I appreciate you guys. I missed you. I literally, as I was driving, I was like, do I put my phone on? And while I'm driving through the desert, talk to you guys in there. I was like, that's not safe, because I'll get all distracted and I'll try to read what you're saying, and then I'll drive off the road, and then next thing you know, I'm in Mad Max. So I thought it best if I started later today. So I appreciate you guys hanging in there for me, and I appreciate you guys, all your support today. I really love that. Like I said, I'll check in with you guys tomorrow. It won't be this kind where I go one-to-one with what he's saying, unless I find a way to do it on my iPad, which I doubt. But in the process, I will be back on Thursday regular, and I'll be gaming fairly regularly and doing all that kind of stuff. And anyways, that's it. I appreciate you guys. I will see you later. Take care of yourself and take care of somebody else. Thanks for all your help today, guys, and thanks again to all the trolls and people who come in and inflate my numbers. I greatly appreciate that, especially when you get in the chat and you post a bunch of nonsense, because it adds to the number of people in the chat. And we're just getting started here, really. So every little bit helps. I mean, I know it feels sad for you to be the cantaloupe in the fruit salad. You know what I mean? You're basically filler, but you have a purpose. And I don't want you to think I've forgotten you. I don't want you to think that I don't appreciate you being there. Is kind of the fiber in the diet. You know what I mean? You're nature's broom. That's what you are. And I appreciate you. And it wouldn't, we wouldn't all be having such big, healthy, colon movements if it wasn't for you guys. So I salute you. And I will see you guys tomorrow. Take care of yourselves and take care of somebody else. And as our great Can't Stop Lying always reminds everybody, reach out to somebody in the periphery of people that you know and love. Find an acquaintance you haven't talked to in a while. Reach out and go, hey, how you holding up with all this stuff? Rekindle some friendships so that when this does get in our rearview mirror and we do open up, and I'm going to be doing a special this weekend, like an hour, on how things will get back to normal, but better at some point, and how that looks. So anyways, take care of yourself and reach out to them, and you guys are awesome, and I will see you very, very soon. Bye-bye.
That was really cool, by the way.
You stay classy, San Diego.
I love lamb. What do you say we cut the chit-chat a-hole? Moon River.
Thank you, Doc. You ever serve time?
Drop your shorts and bend over, Mr. Babar.
I'm a dude playing a dude disguised as another dude.
Did you hear that?
Yeah.
It's a dick for.
What's a dick for?
To pee with.
I never thought anybody could forget so much so fast without a severe blow to the head.
And you know, when you say per capita, this name per capita is just like per capita relative to what? Butthole! We're honored to have with us today our amazing Vice President Mike Pence and his wonderful wife Karen. Butthole! You have nobody guarding your potatoes.
Thank you, Doc. You ever serve time?
You're not hearing what I'm saying.
Oh, that's okay, Doc, because you're not saying what I'm hearing. I never realized how much my advice hurt people until my advice hurt me.
Am I getting through to you? Over!
Man's got to know his limitations.
I love lamb.
That's great psychology. Why don't you just say something bad about my mother?
I couldn't think of a more horrible job if I wanted to. And you have to do it.
Sportos and motorheads, geeks, sluts, bloods, wastoids, dweebies, dickheads. They all adore him. They think he's a righteous dude.